Erectile dysfunction, or ED, is a common condition in men who are 40 years old and older. It's surprisingly common, though, among military veterans who suffered a lower back injury who developed a lumbar spine degenerative condition. I discussed the link between erectile dysfunction and the lumbar spine in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, erectile dysfunction, or ED, refers to the failure to achieve or maintain a rigid penile erection suitable for sexual intercourse. It's a common condition in men, as I said, 40 and older, but its prevalence also increases with age, not just age, but other medical conditions. Now, any disease process that affects the arteries, nerves, hormones, smooth muscle as far as the penis goes can cause erectile dysfunction. That's why it's very closely linked to medical conditions like cardiovascular disease, diabetes, hyperlipidemia or high cholesterol, and hypertension, high blood pressure, among many other disorders. And it's related to dysfunction of the endothelium, the lining of the blood vessels. That appears to be sort of the underlying pathology with all of those medical conditions. As I said, there's many causes, though, of erectile dysfunction. You see it related to depression and performance anxiety and other sexual disorders. Again, age, cardiovascular diseases, hypertension, and a number of other medical, what we call comorbidities, play a role in this condition. That's why when you're writing a Nexus letter, in my case, for erectile dysfunction secondary to the lumbar spine, which I'm about to talk about, you also have to show that's more common than other medical risks that play a role. And so knowing if there's a history of high blood pressure, high cholesterol, cardiovascular disease, you almost need to sort of rule that out so that the lumbar spine can be shown to be more likely the cause. Not just medical, it can be related to things like strokes and sleep apnea and glaucoma, and a number of other things. We mentioned depression, urinary symptoms, medications can cause it, a number of things like that. But specifically, if you're looking at the lumbar spine, low back pain and lumbar spine degenerative conditions, there has been a study looking at this among patients with non-fracture related lumbar spines. So we're talking about no L5 burst fracture or L1 burst fracture, something like that. We're talking about lumbar spine conditions typically more related to degenerative processes. And this is in people under the age of 50. No medical risk factors for erectile dysfunction. The incidence of erectile dysfunction was significantly greater. Another study looked at the relationship between lumbar spine pathology, such as a herniated disc of the lumbar spine, and sexual dysfunction. Among patients undergoing lumbar spine surgery, 55% of the men, 84% of the women experienced sexual problems after their back pain started. Most common sexual problems were decreased desire, premature ejaculation, but also erectile dysfunction, which again was between 18% and 47%. So it is very common. Patients suffering from low back pain have been shown to be more at risk for developing any kind of sexual disability, but most what we're talking about here, erectile dysfunction. And that's why I say you can link the erectile dysfunction to lumbar degenerative disc disease, lumbar spine, spinal stenosis. Again, it gets to a little bit of the more likely than not, as likely as not. If you have a lot of medical risk factors, that argument's a little trickier and the VA might push back. So if you have cardiovascular disease, coronary artery disease, something specific like that, maybe high blood pressure, high cholesterol, those would be a little harder to play down. But if you're on the younger side, you're not in your 60s and your 70s, none of those medical risk factors, and you have a lumbar spine injury or degenerative condition, it can be worth potentially exploring the Nexus letter to try to claim it as a secondary condition to the lumbar spine. If you're interested in learning more about the disability claims process, you can get a free copy of my new ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. Just click the link in the description below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video. You can learn more about working with me and working with my team. We do everything we can to make the process as simple and as quick as we can, and I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.